I first actually got interested in medicine when I was about 7 years old. I had typhoid fever, which is really unusual. I was very sick and I was in the hospital for 18 days. After that, I felt pulled towards medicine. You know, there's something about the chance to take care of people when they're at their most vulnerable that really spoke to me. So that sort of always stuck. I don't think that anyone thought in our lifetimes we would see anything like coronavirus. Life on the COVID wards is both rewarding and tense. There's an understanding of what this disease is and what it can do. And so, you know, the way that we pay attention to donning and doffing the personal protective equipment, the way we are attentive to how frequently nurses, therapists, people who do tests, physicians go into the rooms, we're very thoughtful about those features. People who are sick and very uncomfortable have the chance to get better. And people do get better. I think that that's an important thing to remember about coronavirus, is that it is a disease that lots of people can recover from. And the chance to be a part of that, I think, is really rewarding. Can I ask you to check your pulse, just like this? Just put your fingers on your wrist. Everyone's life has changed as a result of coronavirus, and our lives as physicians is no different in that way. And it looks like, and so switching from an in-office-based practice to a virtual practice, we were able to do that part relatively quickly. And now I worry that my heart patients are scared to seek care because they're worried about getting coronavirus in the hospital. And I worry about the patients with coronavirus, that they're going to have some devastating complication. And so you worry in both directions, which I think is a new feeling for all of us. I think, like everybody, my family has ups and downs with the crisis. We have a lot of home activities that we plan as a family to sort of remind each other that this is a moment to pause and enjoy each other. My wife is the champion of that. Ready? 1, 2, 3. Nice. Many of us worry about being a vector for our families. I think that that's something that's on all of our minds. Everyone is a little bit more anxious than they were 3 months ago, and a little bit more stressed. Nice, good job. Good job, go ahead. You want to try? My wife and kids, if something happened to them, it would be devastating. My greatest fear is that I'm going to give it to my parents. They are, you know, in that higher risk category. You did it! We're cognizant of the risks associated with being a healthcare worker. Medical knowledge has undertaken this grand revolution in the last 2 months because of the pandemic. I think that a wider swath of medical professionals have learned how to quickly interpret data and understand what is good data and bad data in a way that we've never been able to do before. It helped us move faster through the science of coronavirus. I think that we are better prepared now than we were 2 months ago. We'll be better prepared in a month than we are now, because I think the way that we are interpreting and understanding knowledge has fundamentally changed in really, really positive ways,